Today is titled Lessons Learned about the Integrated Care Management of Skin Patients Through the Lens of Atopic Dermatitis. So before we begin, my name is Nicole Sudiacal and I'm the Member Services Manager at GlobalSkin and will be moderating today's webinar. It's really great to see so many familiar faces as well as many new faces. We have a special audience of patient leaders, doctors and medical professionals joining us today from all around the world to learn from our world-renowned guest speakers, Dr. Dagmar and Kathrin, Thormann, who will be speaking about their expertise in integrated care management and share case studies of patients with atopic dermatitis. Without further delay, I will hand over the microphone to our interim CEO, Jennifer Austin, who will introduce the ILDS.
Thank you very much, Nicole. So my name is Jennifer Austin, and I'm the interim Chief Executive Officer of the International Alliance of Dermatology Patient Organizations, also known as GlobalSkin. Some of you are familiar with our organization, of course, but for those of you who are not, we are an alliance of more than 180 patient organizations worldwide in dermatology in over 60 countries, representing more than 65 disease areas. And we provide support, capacity building, and connectivity within the dermatology patient community, and do work in advocacy, research, and reach out to organizations like the ILDS to build collaborative partnerships. And so I'm really pleased that we are co-hosting this session today with the ILDS, and it's also my pleasure to be introducing Professor Luca Borodori. Many of you will know Luca. He is a great champion of the patient voice, and we have been working with him in his affiliation with the EADV and the ILDS for a number of years now. Professor Borodori graduated from Bern, Switzerland, and completed his training at the University Hospital Saint-Louis in Paris and at the University Hospitals in Lausanne and Geneva. He worked as a postdoctoral fellow at the National Cancer Institute in Bethesda and the Netherlands Cancer Institute. And he has a very robust international experience and engagement in his work with the EADV, as well as the International Society of Dermatology, and of course with the ILDS. He chairs the ILDS Patients Organization Working Group, of which GlobalSkin is a member. And as I said, he has really seen the value of collaborating with patient organizations and has been a real champion in ensuring that that is happening in organizations like the ILDS and the EADV. So I'm very pleased to introduce Luca, who will then introduce our guest speakers. So over to you, Luca.
So thank you very much, Jennifer and Nicole, for this very nice and kind introduction. Together with Someone Ado, on behalf of the ILDS, we are also excited today for this new webinar, which the aim of which is again to bring together physicians and patients, to bring them together in order to ensure the best possible interaction, collaboration, and management and understanding of expectation and needs. So today's talk is focused on a very frequent disease, skin disease, which is probably the prevalence of 2 or 3 or 4% worldwide. And I'm delighted to have Professor Dagmar and Kathrin Thormann as speaker. Professor Dagmar, I'm very proud to say that she is in Switzerland and in Europe one of the first dermatologists and allergologists who has understood the importance of integrating and implicating patients in the entire management program for a certain disease. So not only for atopic dermatitis, but for other chronic diseases like chronic contact eczema, allergic eczema. And Dagmar has been for years really implicating in organizing educational courses in which affected patients with a certain disease are directly implicated in better understanding their disease, how they can treat their disease better, what they can do, and they are responsabilized. And during these programs, of course, the physician also has a better understanding what patients need or what are the practical challenges of the patients. That's why I thought that it was a very paradigmatic example. The talk of today of Professor Dagmar Simon together with Kathrin Thormann, which is an excellent advanced nurse practitioner, to illustrate how well and how important it is to coordinate, or to collaborate, and to integrate completely patients in the entire management program, project, or experience on the long term. So in the next slide. So here just just a summary. What is the ILDS, which is an umbrella organization for all national societies worldwide, and regroup approximately 200,000 dermatologists. And of course, our goal is to promote everything which will allow to ensure the best possible skin health for all people all around. And of course, our mission is to increase awareness about skin diseases, cooperation and communication in order to promote education, clinical care, and skin health globally, including also in emerging, underserved countries, like in countries with huge economical difficulties, like in Africa, South America. Next slide. Here, some of our areas of action, which is of course contribute to have an impact on policy, to represent patients and also physicians and patients, and to foster access to dermatological treatment worldwide. Next slide. So the International League of Dermatological Society has understood in the past 5 to 10 years how important it is to work together with patients, and that's why now we have an official working group which particularly deals on focus on how to improve and how to strengthen our exchange with patients association in order to have more impact with all stakeholders and policymakers. Next slide. And so here is just is a very brief introduction of the curriculum vitae of Professor Dagmar Simon and Kathrin Thormann. And as I told you before, Dagmar Simon is a dermatologist, professor of dermatology in Bern, which had made her training in Germany and in Canada. And she has been involved in many clinical trials with focus on atopic dermatitis. And she has been really implicated in patient education program. And Kathrin Thormann is our best advanced nurse practitioner in our department, very motivated because she's now making a PhD in nurse science, and she is directly implicated in this educational program for patients together with the patients, and she's directly implicated in treating patients, and she has a very particular view and sensitivities about the patient's unmet needs. So I leave the word to our two guests because it's more important that they speak rather than I speak.
Thank you, Luca. Kathrin, please feel free to share your screen now.
So I hope everybody can see our slides. Thank you so much for the invitation. This talk is about patient education for patients with an atopic dermatitis, as this is a very important topic when we talk about integrated care management for this specific population. So, why patient education? There is this statement from the WHO that every patient has the right to know about his or her health problem, treatment, and care. And basically, patient education wants to achieve this. So what does this mean for our daily work with patients which suffer of a dermatological disease? So they acquire knowledge about the disease background and the treatment, of course. They gain security in theory and practical skills. And most importantly, it's a patient-centered process. This includes patients' preferences and, of course, shared decision-making. So we really want to empower patients in their self-management. So what is the patient perspective on the management of atopic dermatitis? As you can see here on this slide, these patients suffer a lot, and the atopic dermatitis affects them really very much in their daily life. They have sleep disturbance, they do not feel very confident, they have concerns about their look, they feel unhappy and even sometimes really depressed. They feel helpless during flares, so they do not really know what kind of treatment they need to do. And you can see here at the bottom, they have as well some concerns about using topical corticosteroids. And what was really interesting in this study, we could see that 77% do not feel fully confident managing atopic dermatitis. So there is a big need for patient education for this population. So what should patient education cover for this specific population? Of course, the disease background, and it's quite a complex pathogenesis. Then the topical treatment, so people or the patients, they really need to know when to apply which cream and when they need to adapt the treatment. So self-assessment is really, really important as well for long-term control. And we could see in several studies that patient education improved the adherence, the general health, and the quality of life. So it's really recommended to all patients and or caregivers. So, is it really effective, patient education? There is always this question, does it have an effect? Does the patient have benefits? So in this study, they determined the effect of age-related structured educational programs on the management of atopic dermatitis in childhood and adolescence. And you can see here the results at the bottom and the conclusion. And the authors, they concluded that it's really effective in the long-term management of this disease. So there are several modalities how you can perform patient education. First of all, there is this individual approach, and then there's this group approach. In the individual approach, patient education session lasts between 30 to 60 minutes and can be repeated depending on disease control as well as necessities raised by the patients and or caregivers. The group approach is usually organized as workshops or lectures. The setup can consist of different sessions lasting approximately 2 to 3 hours each, and it is an interprofessional approach, and I think that's the big advantage of this kind of modality. So this raises the question when to use which approach.
And to illustrate how we decide, we want to present 2 cases. But to note, it happens that patients get both individual and group patient education, but we thought there might be some typical cases which we want to present here. So this is a 2.5 years old girl. She came with her mother, who reported that the girl had eczema since early age. Started with a cradle cap, and then she had eczematous lesions on her face, neck, flexural folds, and she was itching, especially when she put off her clothes. There were some trigger factors. The family loved horse riding, and when they came into the girl came into contact with the horses, she had an exacerbation of her skin disease and also a worsening of her asthma. And we also got reported that the family history was positive for atopic diseases. Next one, please. So the parents had already applied to the skin of her daughter creams and ointments, sometimes some corticosteroids. They tried diets, especially they avoided milk and wheat for her daughter, and they also got some homeopathic drugs for her. So we planned how to manage the disease of this child. So we thought about topical corticosteroids and then taper them and switch to topical calcineurin inhibitors. For sure, we advised ointments at basic therapy, also to try to avoid trigger factors, or at least maybe get a shower or bath after contact with horses. And because of the asthma, we referred the girl to the pneumologist. The next one. So when we discussed the therapy with the parents, we got a number of questions, and these are the usual concerns and questions we get from those caregivers. So they ask whether there is an alternative to corticosteroids, and if this is really the correct therapy. What are the side effects? They are sometimes afraid of side effects. They already got some information via Google or whatever. And they want to know how often and how much of these topical corticosteroids they should apply. Then they want to get some information about the topical calcineurin inhibitors, and some are afraid because of the black box warning and really want to know how about malagnomas under this therapy. Then there are also some questions about the basic therapy, which creams, which ointment should be applied, and when, and how to get it into the schedule of the children or the whole family. And there are sometimes concerns about taking a bath or shower, and they ask how often they should do that. There's always a question about the diet, and some really believe if there is that we can identify an allergen that is causing atopic dermatitis, and if they can avoid it, the whole disease will improve. So I think with all these questions, we really have to take some time in order to really get patients or increase patients' adherence to therapy. If they have concerns, they will not do any of the therapy we prescribe. And for that, I usually transfer these patients to Kathrin for patient education, and she will explain now how to do that.
So just to remember you, there are 2 modalities, and we would, of course, choose here the individual approach, as the parents, they have a lot of questions and concerns, so we can discuss with them all these different questions. So how to perform patient education? First of all, of course, you need to have some resources. You need to have healthcare professionals which can perform, which are trained to do patient education for this specific group. Usually nurses are doing patient education in our hospital. Then the equipment, you need to have several materials, a room, of course, then some products for practical, to show practical how to apply creams or ointments, for example. So very important is when you perform patient education, you should never sit in front of a patient. You should sit at right angles because the patient will feel much more confident. And it's a patient-centered process, which means the patient determines the content. But in our experience, it's very, very important to discuss the disease background and the skin barrier function, because when they understand the skin barrier function, they will understand so much better the whole treatment, and that's a very important step for adherence. Then practical demonstration is as well very important. They need to learn, for example, how to do some kind of bandages or how to apply the topical corticosteroid and so on. And then at the end of every session, we do always an action plan with the patient together. That's a very supportive tool for at home. I will discuss this topic a bit later in this talk. So what's the content of patient education at our department? It's the pathogenetic factors and the skin barrier function. Then the avoidance of trigger factors and the identification. That's sometimes quite, it's not that easy to do this. Then the treatment, the basic treatment and the anti-inflammatory treatment. And as I have already said, the action plan. So we have a lot of different folders, a lot of different modules. They help to support us during patient education. That's kind of a theoretical background. So we would use, in this case, which Dagmar Simon showed us, the model for skin cleansing. That's the icon with this shower, because they had this question, is my child allowed to take a bath and how often? So this model would look like this, skin cleansing. So it's very clear. There are not a lot of information on this slide. So we would say, yes, the child can take a bath or a shower, but not too long, and the water shouldn't be too hot, and once per day is required. We would discuss as well the differences between soaps and Syndex, and here you can do as well a little exercise with the patient together with these pH value sticks. So the patient, they can measure actually the pH value, and then they can see the differences between a Syndex or a soap. Of course, we discuss as well the different oils. So the patient can just put the oil into the water and then they can see the differences between the oil. For the skincare, we usually discuss why. Why is this important? To restore the skin barrier function, for example. How often? Here it's written several times a day, but you need always to discuss with the patient together what's really, what can they do during their day, what's really useful for them, and of course which product, and that's really, really important. When the child doesn't like the product, she doesn't want to use it, so the product with a high acceptance is quite important. And after every patient education session, we fill out this patient action plan with the patient together. And as you can see, it's very, very simple. At the bottom is the basic therapy. So you can just write down which cream, which ointment they need to use to moisturize the skin and how often. Then yellow and red is the anti-inflammatory therapy. So you can write down which corticosteroid they need to use and when. So that's very a useful tool for at home. The patient can just have a quick look and then he or she knows what she or he needs to apply. Please, Dagmar.
Okay, and with that we come to the next case. This is a young man who also reported eczema since infancy. He reported a chronic lapsing course, and usually the flexural folds, the hands, and also the head and neck area were affected. He had additional or concomitant atopic diseases like allergic rhinitis and bronchial asthma. And when we asked for trigger factors, he told us that during the pollen season, he gets flares, and also in case of stress, for instance, before exams. The next, please. So he had already used different ointments and emollients, body lotions, also topical corticosteroids. Several times he got all corticosteroids, and he also tried several diets. So our plan for him was to start with a basic therapy together with topical corticosteroids and calcineurin inhibitors. But because of his chronic lapsing disease course and widespread eczema, we also considered a systemic therapy. So usually we start with cyclosporin, and if it doesn't work sufficiently, we switch to dupilumab. So like in Switzerland, dupilumab is a second-line systemic therapy. Next, please. And when we discussed these options with the patient, he came with a number of questions and concern. First is how he can control the itch, for how long he should apply topical corticosteroids and calcineurin inhibitors, how dangerous they are, what are the side effects, should he again start a diet, for instance, avoid milk, egg, or wheat, or gluten. He also wanted to know the benefits and limitations of complementary medicine. But when he discussed stuff and talked a while, he also reported that he is quite ashamed of his atopic dermatitis lesions, especially those on the face and neck area. He reported flares following stress. He also had a disturbed sleep, resulting in fatigue. Sometimes he was so tired that he had difficulties when learning or working. And another question these patients often raise is, how can I explain my skin disease to others? Often the other think it's infectious, and how should I do that? So, and I hope also for that we have a possibility to help these patients. And I would ask Kathrin again to discuss it in the next minutes.
Yeah, as you can see, in this patient has a lot of interdisciplinary questions. That is why we would advise him to participate in a workshop. As this is interprofessional, so there is always a dermatologist, allergist, which talks about the whole pathomechanism of the atopic dermatitis and the management. But there is as well a psychologist which speaks about coping strategies, how they can deal with itch, for example, or with stigmatization. Then there's a nurse. She speaks about the basic therapy, and she shows as well how they can do some kind of bandages and so on. Then there's a dietitian. She speaks about the nutrition, and a physiotherapist. He offers a training in progressive muscle relaxation. So these workshops are very interactive, and we do have a lot of discussions there as well between the different peers, and practical skills are as well very important, that they learn practical skills there. So during the pandemic, we couldn't do this workshop in our clinic, so we did it online, and yes, it was possible to do it online, and well accepted as well by the patients. So the summary: patient education in atopic dermatitis. Why? Needs on patients and doctor sides. Who for atopic dermatitis patients and caregivers. What individual therapeutic patient education or workshops for patient groups. Dermatologists, allergists, nurses, psychologists, dietitian can perform patient education for this specific group. And information and practical skills we give them information and practical skills. So it's an effective tool, and we give them some written eczema action plan after every patient education session. The educational workshops is very effective, and short time between follow-up sessions is quite important. So thank you very much for listening.
Grateful to our speakers. Thank you so very much for sharing your expertise, and thank you to the ILDS for co-hosting this event with us, and all the great interest shown by our participants. So we're grateful to be able to connect during these challenging times, and wishing you all good health and a lovely spring if you're in this hemisphere, and I guess fall if you're in the other hemisphere. So take care, everyone. Thank you.